Welcome to our video about the American medical system and whether it's truly top tier. Are you tired of hearing that the US has the best healthcare in the world, yet feeling like something's off? Have you ever wondered why, despite being the most expensive healthcare system in the world, the outcomes are not always the best? Well, you're not alone. In this video, we're going to take a deep dive into the American medical system, highlighting its strengths and weaknesses, and using data and statistics to paint a clear picture of where the system stands. We'll also be discussing what it would take for the American medical system to become truly top tier. So, whether you're a patient, a healthcare professional, or just curious about the state of healthcare in the US, this video is for you. Get ready to have your eyes opened and your mind blown as we explore the American medical system and what it takes to be truly top tier. So, sit back, relax, and enjoy the ride. The United States is often touted as having one of the best medical systems in the world, with cutting-edge technology and skilled practitioners. But is this reputation truly deserved? As healthcare costs continue to skyrocket and reports of inadequate care surface, it's worth taking a closer look at whether the American medical system is truly top tier. From long wait times for appointments to lack of access to affordable care, there are certainly some flaws in the system that cannot be ignored. On one hand, the US has some of the best hospitals and medical research centers in the world, and many of the latest medical advancements are developed and implemented here. The country also has a large number of highly trained and skilled doctors and nurses. However, the high cost of healthcare is a major issue. The US spends more on healthcare than any other developed country, yet still has a higher rate of uninsured individuals and a lower life expectancy than many other nations. Additionally, there have been numerous reports of patients receiving substandard care, particularly in rural areas and among marginalized communities. It's clear that there are both strengths and weaknesses in the American medical system. While it may be true that the US has some of the best medical technology and practitioners, it's also true that the high cost of healthcare and lack of access to care for many Americans is a significant problem. The question remains whether the system is truly top tier when compared to other nations. In terms of advantages, the United States has some of the most advanced medical technology and equipment available. From imaging and diagnostic tools to surgical procedures and treatments, American hospitals and clinics are often at the forefront of medical innovation. This can lead to better outcomes for patients and can make it easier for doctors to diagnose and treat illnesses. Additionally, the United States has a large number of highly trained and skilled medical professionals. The country has more medical schools and residency programs than any other nation, which means that there is a constant influx of new doctors and nurses entering the workforce. This can lead to better access to care for patients, and can also improve the quality of care provided. However, there are also several disadvantages to the American medical system. One of the most significant is the high cost of healthcare. According to data from the Organization for Economic Cooperation and Development, OECD, the United States spends more on healthcare per capita than any other developed country. This can make it difficult for many Americans to afford the care they need, and can also lead to financial strain for those who do have insurance. Another disadvantage is that the American medical system is not always able to provide equal access to care. This can be seen in the disparities in health outcomes between rural and urban areas. In conclusion, while the American medical system has its advantages, such as advanced technology and a large number of skilled medical professionals, it also has several disadvantages, such as high cost of healthcare and lack of access to care for many Americans. When we look at data and statistics, it is clear that the disadvantages outweigh the advantages, and the US healthcare system is not truly top tier when compared to other nations. The government and healthcare providers should take a closer look at the issues in the system and find ways to improve access to affordable care for all Americans. Here are some data points related to the topic of the American medical system. According to data from the Organization for Economic Cooperation and Development, OECD, the United States spends more on healthcare per capita than any other developed country. In 2018, the US spent $10,224 per capita on healthcare. According to a report from the Commonwealth Fund, the United States ranked last among 11 developed countries in terms of access to care. According to data from the Centers for Disease Control and Prevention, CDC, the life expectancy in the United States is lower than in many other developed countries. In 2018, the life expectancy in the US was 78.7 years, compared to an average of 81.7 years in other OECD countries. According to a report from the Kaiser Family Foundation, the United States has a higher rate of uninsured individuals than any other developed country. In 2018, about 10% of Americans were uninsured. According to a report from the Commonwealth Fund, the United States ranked last among 11 developed countries in terms of affordability of healthcare. According to data from the CDC, the United States has a higher infant mortality rate than many other developed countries. In 2018, the infant mortality rate in the US was 5.8 deaths per 1,000 live births, compared to an average of 3.6 deaths per 1,000 live births in other OECD countries. To become truly top-tier, the American medical system must address the disadvantages that currently exist. One way to do this is to work towards reducing the cost of healthcare. This can be done by implementing measures such as price transparency, increasing competition among healthcare providers, and reforming the way that drugs are priced. Additionally, the government could consider implementing a single-payer healthcare system, which has been shown to be effective in controlling healthcare costs in other countries. Another way to improve the system is to address the lack of access to care for many Americans. This can be done by increasing the number of community health clinics and mobile health clinics in underserved areas, as well as by providing financial assistance to those who cannot afford healthcare. Additionally, the government could increase funding for programs such as Medicaid and the Children's Health Insurance Program, CHIP, to ensure that more Americans have access to affordable health coverage. In addition, the government and healthcare providers should work to address the racial and ethnic disparities in health outcomes. This can be done by increasing funding for community health programs that serve minority populations, as well as by recruiting and training more minority healthcare providers. The government should also invest in research to identify the root causes of these disparities and develop targeted interventions to address them. Finally, the government and healthcare providers should work to improve the quality of care provided. This can be done by implementing quality control measures, such as regular audits and inspections, as well as by providing ongoing training and education for healthcare providers. Additionally, the government could invest in technology that would help to improve the delivery of care, such as telemedicine and electronic health records. In conclusion, while the American medical system has some strengths, it also has several weaknesses that must be addressed. By working to reduce the cost of healthcare, increasing access to care, addressing the racial and ethnic disparities in health outcomes and improving the quality of care provided, the American medical system can become truly top-tier. Thanks for watching. If you found this video informative, please don't forget to hit the like button and subscribe to our channel for more videos on the medical system in the USA. We'd also love to hear your thoughts in the comments below.